Good afternoon, dear colleagues. My name is Alina Osyntseva, and I am a candidate of Pharmaceutical Sciences. Today, in my presentation, I will provide an interdisciplinary review of the therapeutic potential of Calendula Officinalis L in patients with tuberculosis and comorbid conditions. The study covers pharmacology, market analysis, clinical relevance, and the use of calendula preparations in supportive and palliative therapy. Tuberculosis remains one of the most challenging infectious diseases. Most patients develop gastropathies, hepatotoxicity, stomatitis, dermatitis, and other conditions that require supportive therapy. In these circumstances, herbal preparations with gentle physiological effects can play an important role. Calendula officinalis is one of the most thoroughly studied plants. It contains triterpene saponins, flavonoids, essential oils, carotenoids, and polysaccharides, which provide a wide range of pharmacological activities most relevant for patients with tuberculosis. The pharmacological effects that Calendula officinalis has on the human body include antibacterial, anti-inflammatory, immunostimulatory, and wound-healing actions. Calendula modulates inflammation by suppressing pro-inflammatory mediators. It is active against staphylococci, streptococci, and intestinal flora. Certain components accelerate the healing of mucous membranes, which is very important in cases of stomatitis and gastropathies, common among patients with tuberculosis. In real clinical practice, we see that the side effects of primary treatment are significant, so phytotherapy with Calendula officinalis can help reduce toxic load and support the liver, reduce inflammation of the mucous membranes, and improve the patient's overall condition. In Ukraine, more than 17 calendula-based medications are registered. These include both monocomponent preparations in the form of tinctures and ointments, as well as multi-component remedies, which allow for the selection of the optimal form for various clinical situations, from gastritis to stomatitis and bronchitis. These medications address the most problematic clinical areas of comorbid conditions in tuberculosis. Rotocan is especially useful for treating patients with oral cavity lesions, and Gastrofit is used for gastroprotection. The most commonly used forms are tinctures and herbal blends. For patients with tuberculosis, mouthwash solutions and ointments for treating dermatological lesions that occur after prolonged antibiotic therapy are especially beneficial. As part of our study, we conducted a SWOT analysis, and here on the slide, the strengths are presented. They include natural origin, good tolerability, and the ability to have a comprehensive effect on various organs and systems. This allows calendula preparations to be used in various clinical fields simultaneously. The weaknesses identified in the SWOT analysis include a limited evidence base for specific nosologies, absence from evidence-based medicine protocols, market instability, and high variability in quality. The SWOT analysis revealed the following opportunities: increasing demand for natural remedies, potential in palliative and supportive therapy for tuberculosis, the possibility of inclusion in new comprehensive therapy protocols, and potential for export expansion. The main barriers are the lack of inclusion in official protocols and the difficulty of redirecting phytotherapeutic agents. However, existing clinical experience and positive pharmacological properties indicate that these barriers can be overcome through further research and standardization. The regulatory situation shows that the market for calendula-based phytopreparations is generally stable. However, certain products have disappeared due to the lack of re-registration or changes in regulatory requirements. This affects the availability of medications for patients and medical institutions. Today, more requirements concern toxicological aspects and clinical data even for herbal remedies. Some manufacturers have not managed to update their dossiers, so certain phytopreparations have been removed from the registry. This is not a matter of quality but of regulation. Phytotherapy does not replace primary treatment, but it significantly improves the tolerability of antibiotics. This is critically important. After all, the effectiveness of anti-tuberculosis therapy depends on adherence to the treatment regimen. Patients with tuberculosis often suffer from complications that significantly reduce their quality of life. It is specifically phytotherapeutic agents with Calendula Officinalis that help reduce these symptoms and assist in completing the full course of treatment. For state and municipal institutions, it is important that the remedies are accessible and cost-effective. Preparations containing calendula meet both criteria and can be included in palliative care standards. Combined phytotherapeutic agents demonstrate a synergistic effect. For example, the combination of calendula with chamomile and yarrow in Rotocan provides a powerful anti-inflammatory and antiseptic action. Such combinations make it possible to address several symptoms at once. The pharmacoeconomic advantages of calendula-based preparations lie in their ability to reduce the frequency of side effects, which decreases the need for corrective synergistic medications and repeat hospitalizations. An analysis of official instructions confirmed that the actual spectrum of action meets the needs of patients with tuberculosis. This shows that the available remedies have real clinical potential for adjunctive therapy. In patients with tuberculosis, we are dealing with several problems at the same time. These include liver disorders, mucosal damage, and reduced immunity. Calendula acts on all of these factors at once, making it a unique tool for adjunctive therapy. The prospect lies in creating regulatory documents where phytotherapy will be considered as part of palliative and supportive treatment for tuberculosis. This will improve the quality of patient care and allow for standardized approaches. Regarding the use of calendula preparations, primary care physicians encounter patients every day who suffer from gastropathies, stomatitis, and dermatological lesions as a result of anti-tuberculosis treatment. Preparations containing Calendula officinalis are a safe and effective tool for managing these symptoms at the outpatient stage. Calendula officinalis does not compete with antibacterial drugs. It complements them. The use of local and systemic forms allows for effective management of side effects without altering the main treatment protocol. One of the greatest challenges in tuberculosis therapy is liver damage. It is precisely the choleretic and hepatoprotective properties of calendula that are of significant value. Their clinical effect is manifested in the reduction of dyspepsia and improvement of appetite. Stomatitis is one of the most common complications of prolonged antibiotic use. Rinsing with calendula solutions significantly reduces the duration and intensity of inflammation, as well as improves patient comfort. Dermatological problems are a common comorbid condition in patients with tuberculosis. Ointments and gels with calendula have pronounced anti-inflammatory, antifungal, and reparative effects. This is important for maintaining the skin's barrier function. Patients with tuberculosis often develop respiratory complications, especially secondary infections. Combined herbal preparations with calendula reduce inflammation of the mucous membranes and help relieve cough. Women undergoing long-term treatment often experience gynecological complications related to decreased immunity. Suppositories and tinctures with calendula help restore the mucous membrane and reduce inflammation. Herbal preparations with calendula have a very high safety profile, which allows them to be used for extended periods. This is important in cases of chronic infections and comorbid conditions, where long-term recovery is necessary. Although calendula-based preparations are safe, they cannot replace anti-tuberculosis drugs. They are used exclusively as an adjunct component. It is also important to take into account the individual sensitivity of patients. The quality of herbal preparations directly depends on standardization. For calendula, it is important to control the content of biologically active substances. This increases the predictability of the therapeutic effect and doctors' trust in phytotherapy. Mono preparations provide a clear, focused effect, but combined preparations allow for addressing several symptoms at once. For patients with tuberculosis who have several accompanying symptoms, combined preparations are often more effective. Flavonoids, such as quercetin and isarhamnetin, are primarily responsible for most of calendula's well-known anti-inflammatory properties. They play a special role in protecting mucous membranes and liver tissue under toxic stress. Triterpene saponins are the basis of calendula's reparative effect. They accelerate the healing of mucous membranes and epithelial tissues, which is critically important for patients with gastritis, stomatitis, and dermatitis against the background of tuberculosis. Calendula not only reduces inflammation but also stimulates nonspecific immunity. This is important for patients undergoing long-term therapy and those with secondary immunodeficiency conditions. In hospitals, calendula preparations are often used to treat stomatitis, bed sores, dermatitis, as well as to support the liver and gastrointestinal tract. They combine well with antibiotics and do not affect the metabolism of anti-tuberculosis agents. At the outpatient stage, phytotherapy is especially valuable since patients often require long-term support. Preparations containing Calendula Officinalis provide comfortable use and a noticeable reduction in symptoms. Most preparations with calendula belong to the budget segment. This creates additional opportunities for their widespread use in public institutions and among socially vulnerable groups of the population. Pharmaceutical care plays an important role, as patients often use herbal remedies on their own. Pharmacist consultations ensure proper use and increase the effectiveness of therapy. International experience confirms that calendula is not only a traditional remedy, but also a modern phytotherapeutic component. Its effectiveness is being actively studied, which strengthens the position of this plant in evidence-based medicine. The available data allow us to speak about the significant clinical potential of calendula. However, for its formal inclusion in protocols, large-scale clinical studies are needed, which are now actively being launched in various countries. Studies show that calendula does not affect the pharmacokinetics of major anti-tuberculosis drugs, does not cause interactions, and may reduce side effects, making it safe for use in adjunctive regimens. Improvement of the condition of mucous membranes, skin, digestion, and overall well-being reduces stress, increases adherence to treatment, and lessens the psychological burden experienced by patients with chronic diseases. In palliative care, it is important to alleviate symptoms that reduce quality of life. Calendula can be useful for respiratory, gastrointestinal, and dermatological disorders, which are important to manage with synthetic agents. Since most of the medications are domestically produced, they are not affected by currency fluctuations and are affordably priced. For government programs, this is important from the perspective of budgeting, as well as palliative and supportive care. The main barriers are not clinical, but regulatory. The lack of large clinical studies and official protocols is a hindrance to the standard use of phytotherapy, even when its effectiveness is evident. A systematic approach makes it possible to increase the trust of the medical community. Standardization of extracts and training of specialists are the key to integrating phytotherapy into modern medicine. The next step is to conduct studies that will demonstrate the effectiveness of calendula in specific pathologies related to tuberculosis and comorbidities. The market for natural remedies is growing every year. Ukraine has strong potential for the production of phytopreparations, including those oriented toward export. Calendula is a promising raw material for such products. The use of inexpensive herbal remedies to support patients is economically advantageous. This reduces the costs of additional medications and the burden on the healthcare system. Calendula officinalis is a universal plant whose effects cross the boundaries of several specialties. It is precisely interdisciplinary analysis that allows us to properly assess its place in modern tuberculosis treatment. In most medical institutions, phytotherapy is not formally prescribed, but it is actively used in practice. Including calendula in clinical pathways will allow for standardized care and increase treatment effectiveness. The scientific potential of calendula is significant, with particularly relevant research concerning the treatment of gastropathies, stomatitis, and dermatitis in patients undergoing aggressive antibiotic therapy. Collaboration between medical professionals, scientists, and manufacturers will make it possible to create modern phytotherapeutic products based on evidence-based approaches and standardized extracts. Ukraine has a strong raw material base. Production infrastructure, and scientific schools. Calendula officinalis could become one of the promising export phytocomponents. For doctors, it is important that calendula preparations have a low-risk profile and can be used in a wide range of patients, including those with chronic comorbid conditions. For patients, it is important not only to cure tuberculosis, but also to maintain quality of life throughout the long course of treatment. Phytopreparations made from calendula significantly improve well-being without additional toxic burden. Calendula is an effective and safe tool for supportive therapy, which has significant potential for implementation in standardized clinical practice. We recommend considering the inclusion of calendula-based remedies in palliative and supportive treatment regimens for patients with tuberculosis, especially at the outpatient stage. The report utilized drug instructions, scientific articles, market reviews, and analytical materials, which made it possible to conduct a comprehensive analysis. Thank you very much for your attention. I will be happy to answer your questions and discuss opportunities for further research and collaboration.